How to help prevent prostate cancer with a healthy diet. Although there's no sure way to prevent cancer, the right diet may help lower your risk. You will need moderate-sized portions and the right foods. Step 1. Maintain a healthy body weight by keeping your calories under control and eating moderate-sized portions. Overindulging on food can increase your risk for cancer. Step 2. Cut back on saturated fats like the animal fat in red meat and trans fatty acids found in margarine and fried foods. Cultures that have higher prostate cancer rates tend to have more fat in their diet. Eat more fresh fish, which has the beneficial omega-3 fatty acids. Step 3. Make fruits and vegetables a key part of your diet. Vegetables high in folate, like spinach, asparagus, and beans, have been linked with preventing many types of cancer. Cruciferous foods like broccoli and cauliflower help in prostate cancer prevention. Step 4. Consume whole grain foods such as brown rice and whole wheat bread. Whole grains also provide your body with needed fiber. Step 5. Lower your intake of sweets and salt. Once you get used to using less of these condiments, you won't miss them. Step 6. Drink alcohol in moderation. Heavy drinking can increase the risk of aggressive prostate cancer. Limit yourself to 2 drinks a day. Step 7. Practice moderation in your diet. Don't eat or drink any of the recommended foods in excess. Keeping your diet diverse will help you live a healthy life. Did you know? As of 2010, the National Institute of Health reported that African American men are 60% more likely to develop prostate cancer than Caucasian men.
Breast cancer prevention guide. Now pay close attention because I'm revealing the 3 things every woman needs to know to save her life. And Dr. Funk, let's start with you if you don't mind. Researchers have isolated 2 key areas for cancer prevention. Estrogen regulation, right? How estrogen stimulates your breasts, and immunity boosting. So I love to move into the first area, which is food. But if you're okay with it, just break those up for us.
Well, the anti-estrogen category is it's critical because the root of all breast cancer, well, is a genetic change, but it is fed and fueled for the most part by estrogen. So if we can decrease estrogen in our bodies, we can remove some of that fuel that makes those cancer cells multiply, divide, and spread.
Right. And then the immunity strengthening is obviously making it so that if you do have cancer, your immune system is saying, hey, wait a minute, I don't want that anymore. I'm taking that out of the picture. And that's what we're talking about right now. How do all of us, whether we've had cancer in the past or not, make sure that we can stay out of the big C word territory. So these are foods that I've heard through the grapevine you may actually have been using during your recovery process, foods you may have some confidence around.
Yeah.
And what's amazing to me is that your intuition was absolutely on target because every food, in fact, all of these 3 steps we're going to talk about have hardcore, deeply rooted scientific evidence behind them. So, you have any memories about these?
Well, I'll tell you, at this point, everything is about moderation. If you know something's not good for you, you just try to eliminate it. Everything about green leafy vegetables, colorful vegetables in general, and sea vegetables like seaweed or kelp or kale or just green leafy vegetables in general, there's a lower cancer rate in women who follow that sort of dietary measure. And almost any vegetable you get, you can find it in a color. I mean, there's purple cauliflower. There are orange potatoes, obviously.
You are really an expert at this.
Well, I'll tell you nothing to say, Cheryl.
All right, we'll be right back. This is wonderful. So let me ask you, let me just start just to organize our thoughts around green tea.
Well, green tea is very high in antioxidants, and that's one of the things when I was going through my treatment. That's why I wanted to do acupuncture and drink the stinky teas, because I felt like anything that was immune boosting was going to help my body to fight and also to incorporate the Western treatment I was going through. So to fortify the body while my cancer treatment was killing the cancer cells and also the good cells. So, green tea is wonderful for that.
Well, there's a study just recently that came out looking at green tea and the power that it had over actually reducing the chance of getting breast cancer. If you have 3 cups a day, it reduces the chance of getting breast cancer, not by 5% or 6% or 50%. I mean, 50%. If you could have a drug that did that,
Yeah.
you'd take a lot of it.
Yeah.
3 cups of green tea makes a ton of sense. You were doing it. It may be partially responsible for how well you've done together with all the other things you were doing. But I can tell you, for a lot of folks watching right now, I put that on my radar screen, especially if you have any concerns about breast cancer. I've got a big list, by the way, of these things. I'm going to go through them real quickly. So, Dr. Funk, garlic.
It definitely boosts your immune system and has anti-inflammatory properties. So garlic is a great fighter against breast cancer. Again, with the green tea, 3 cups of green tea a day. We've
Olive
got
oil.
some olive oil. This has some tumor suppression activity, meaning it calms the HER2 receptor down, nothing like the drug Herceptin. However, olive oil does have some properties in that respect. It's a monounsaturated fat. You want to learn what your healthy fats are, like olive, borage, walnut, flaxseed oil. Stay away from the butter, margarine, and lard.
Turmeric.
And turmeric is part of the curry and ginger family, and that also decreases estrogen in your body and is important. We've got some cruciferous vegetables, like Cheryl was talking about, the kale, bok choy, Swiss chard. Those are estrogen binders in your GI tract, along with the fiber involved with the vegetables.
We're clear on this. So there are chemicals actually in the leafy green vegetables that bind up estrogen, so reduce the stimulation of the tumor. They also, by the way, detoxify your liver, so you don't have toxins flowing through your body that can irritate cells and turn them into early cancers. So we covered food. We're all clear on food? Right? I mean, it's ultimately, this is the pharmacy. It happens to be sold in a grocery store that so many of us need. Step 2 is about a daily dose of vitamin D. And Dr. Funk, if you could walk us through vitamin D. We talked about it on the show a lot. What dose and why does it work?
So vitamin D, 2,000 international units a day. You want to get it from dietary sources. Cod liver oil and sardines are really rich, but maybe not palatable. So salmon and some dairy, like milk and cheese, you can find vitamin D. A few minutes a day of daily sunshine. So vitamin D and sunshine.
So the third thing on this list may be something that naturally changes the way we make estrogen. That's use of either aspirin or ibuprofen-type drugs that actually work to change some of the basic mechanisms by which we process chemicals in our body. How do they work?
Well, there's a whole field of that's evolving in science showing that the inflammatory process plays a very pro role in causing malignancies in a number of different organs, including colorectal cancer, gastric cancer, lung cancer, as well as breast cancer. It's been shown, first in colorectal cancer, and now the other cancers are starting to show the same evidence, that the use in moderation of anti-inflammatories can reduce incidence. And I think that's what's getting a lot of traction right now. It started with colorectal cancer, but we're now seeing it in the other malignancies.
And so the dosing, I'm usually telling folks, I wonder if you agree, is twice a week at least. And I'm going to say right up front, I mean, as a heart specialist, it definitely has a benefit for men in heart disease. And for women, too, maybe not quite as much. Women have some other potential issues with taking aspirin, so I don't always push it as hard. But I think twice a week makes a lot of sense for either aspirin or ibuprofen. Is that what you're telling your patients?
Yeah, we tell our patients that, as well as the cardiovascular risk issues that sort of mini aspirin doses has an impact there. So I think there's a twofer, if you will, in terms of health prevention that could be positive.
Cheryl, I don't know what to say, Dr. Crow.
I'm taking this with me.
That you take that with you. A big thanks. Appreciate it. Thank you very much. Congratulations. Cheryl's new album comes out in July. It's called 100 Miles from Memphis. I want to thank also Dr. Funk, Dr. Staley so much. You can find my ultimate breast cancer prevention guide and more information about Stand Up to Cancer on DrOz.com, and we'll be right back.